were some key personalities in the coal mining industry and the union movement at that time, and what events in particular made them remarkable?
Let me talk about Enoch Williams to start with. Enoch Williams grew up in Nova Scotia in the coal mining area, and he came west because he heard about the Klondike gold rush. But his information about the Klondike was off because it was over by the time he got here. So he looked for other things to do, and he got involved in the coal industry and ended up here in the Crowsnest Pass, and was very active in the union movement and was a working miner in the pre-World War I period, right through the World War I, and was a prominent labor leader by the 1920s, and was involved in the UMWA as a leader, was a member of the Communist Party, and involved in organizing the miners to support the communist program, which was the most socialistic of the political parties at the time. And of course, he became famous in the past because he was elected as mayor of Blairmore in 1936. But you know, I mentioned communist, and you think the guy must have been like totally out of his mind, radical. But we're talking about a time when Canada didn't have the social welfare programs that exist today. And so a big program of the local unions in the Crowsnest Pass in the 1940s was to establish the first real modern hospital. And so the three union locals, the Bellevue, the Blairmore, and the Coleman union locals, worked together very hard for the whole decade to organize a movement to establish a community hospital in the Crowsnest Pass. And Enoch Williams was the main leader. And the new Crowsnest Hospital was opened in 1949. But its location was interesting because it was purposely built halfway between Coleman and Blairmore, because of course you had to split the difference between the two major towns, otherwise people would be upset. But Enoch Williams was the key person, and in fact was the first president of the board that ran the first modern hospital. And the cool thing about that modern hospital was that it prefigured our universal hospital care system that was introduced in Canada in 1957. So if you went into the hospital to deliver a baby or to have an operation, or for whatever reason, you didn't pay anything in the Crowsnest Pass because it was part of the, you know, the public health care system, but it was a system just for the Crowsnest Pass ratepayers. And so this just prefigured what would be introduced all across Canada starting in 1957. And so yes, they were socialists, but they were pragmatic socialists.